Hi, welcome everyone to the Brazil UK Forum 2020. I'm Lia Pessoa. I'm a master's degree student at the London School of Economics. I'll be here with you today at this panel, Future of SUS. This work is available thanks to the team of volunteers and to Fundação Haddad, Fundação Lehman, Debbie Data, and law firm BGM, and also our broadcast partner Estadão, which gives us the opportunity to transmit the event throughout the world for free. One of the most ambitious projects of Brazilian redemocratization was the creation and implementation of the Brazilian health system, which is free of charge and available for everyone. The pandemic of the COVID-19 is this system's greatest challenge. It's the greatest, but not the only one. Today, we're going to talk about the large challenges that this system, this Brazilian health system, SUS, has faced. What are its advantages? How it reaches the Brazilian population? What other transformations does it have to go through to work for everyone? It's a pleasure to have here with us Ligia Bahia, researcher and professor of the School of Public Health of the Rio de Janeiro Federal University, and also a reference in public health in Brazil. Gilson Rodrigues, community leader, president of Escola do Povo, and also of the Association of Paraisópolis, president and coordinator of G10 Favelas. Dráuzio Varella, physician and doctor. He runs one of the most popular public health websites. Thank you all for accepting our invitation. I'll start with Ligia. Ligia, you're one of our main specialists in public health. Explain to us, please, what does it mean to Brazil to have a public, national, free of charge health system in Brazil? Well, thank you for the invitation. It's an honor to be here with my colleagues, Dráuzio, Gil. Thank you, Lia. For us, the SUS is like the eighth wonder of the world. It's a huge landmark in terms of civilization because it's national, it's free for all. It's a great step for the transformation of what was a country based on huge inequality with some type of assistantialism actions, but now we have this which was created through the 88th constitution, and we considered that the Brazilian health system, the SUS, is the eighth wonder of Brazil because it took health from where it was of pure assistantialism and provided it with a much more interesting approach as understanding it's a right to all Brazilians. We are the only capitalist country in the world that is an average income country that has a public health system. So we're very proud of this system. So it's a huge leap for Brazil, and we've managed to take this leap. It's inspired in the NHS and other models that are very similar and that assume that health is a right of the citizen. And Brazil now has become a very prominent country in the international set in this approach, in this national health system approach. Of course, it's very demanding also, and we'll probably address this demanding issue today. Exactly. I would like to also ask, based on what Ligia said, I'd like to ask you, Gilza, about 70% of the Brazilian population depends exclusively on the SUS to access health. Gilson, since you became a president of the Paraisópolis Association more than 10 years ago, you have worked very hard to have the SUS reach the community. So tell us, Gilson, despite the project, what is the reality of the SUS in Paraisópolis. First, I'd like to thank the opportunity to be here with you, Professor Ligia, Dráuzio Varella. This debate is very important, especially in a pandemic situation, and it's an opportunity to talk about the realities of Brazil and favela. And the SUS reality is that in the favelas, it's an even worse situation, and the situation here is nearly collapsing in terms of reducing the number of people that are going to die. It has not been achieved, especially regarding the less privileged situation. There are many millions of Brazilians that live in human conditions with small houses, crowded houses, that live in places that don't have the basic sanitation needs. So they do not have access to the prevention and treatment that the World Health System recommends. The SUS does help, but for now, it's suffering because we lack leadership, because the governing authorities here, they're not providing the actual information we need. We've been past 30 days and the death toll is still rising. The SUS is a spectacular program that meets our population's needs, the population that most need the SUS. It is an example to the entire world, especially to emerging countries, but now we lack investment, we lack care towards the population in need. I recently read some news saying that some Americans, for example, have to pay to be cured. We don't have this in Brazil, but the situation of the SUS from now on, as we have seen through several indications, is that it has to improve much more so we can learn from our mistakes, our errors, that we don't have that many deaths from the pandemic, and to show the world how our population mobilizes itself, organizes itself towards health. What I believe, Ligia and Lia, is that the population has taken the reins of the pandemics now. If we have to count on the government, the situation would be much worse. So we have organized ourselves to make things happen. Here in Paraisópolis, for example, we have 100,000 people living in the favela. It's I never thought, it wasn't my dream to live in a favela, in a risk area. Of course I didn't. My wanted to be rich, to be honest, when I came to São Paulo, but the lack of public policies and all the hardship I've been through has put me in a situation that the favelas are a place where we continue in the same situation, and we continue expanding in a very unorderly manner. We need to hire equipment to guarantee all the access the population needs. We are doing our part, and we're only counting on the Paraisópolis population. So now what we lack here at Paraisópolis is a president, Brazil's president, São Paulo's governor, and São Paulo's mayor. We can only depend on us, unfortunately. Lia, thank you. And now we want to learn much more about this project. But before we start talking about the community initiatives, which have had a very key role, as you have mentioned, in the state scope, if we can put it this way, I would still want to debate a bit more about the health public policies. Dráuzio had a small connection problem. He's trying to solve it. I hope he can be with us, but while that did not happen, we'll continue with the debate. I would like to talk about the importance of the SUS, as you too said, the advantages it gives to people to face and to fight against the pandemic. Gilson, you said that you read about the United States, people are paying for their treatments. So to close the first block about the SUS, and before we further on the COVID-19 issue, which we also want to address a lot, Ligia, if you could tell us, what do you think the SUS, as a Brazilian national health system, what can it teach the world and learn from the world at this time of the pandemic? Well, I think that the SUS has a lot to teach. For example, Brazil is an epicenter of the pandemic, but we don't know what's going to happen in India, for example. And India is much more populated than Brazil. So there is great fear that the COVID-19 causes an explosion of deaths in India. That worries a lot in the international scope, and India does not have a public national health system free of charge for everyone. They're still debating about this topic, but they haven't decided within the constitution as we did. So it's very important for us to understand that the SUS is something we achieved. It's a civilizatory achievement, because without this, people would die. Those who cannot pay for their treatment would be condemned to death, a pre-condemnation to death. And that's very sad in a moment where the world only accumulates wealth with all this richness and technologies. We have a body of knowledge, technologies, possibilities, treatments, vaccines, care, and it's not fair that they are not provided to the entire humanity. All this knowledge, science is co-produced by humanity also, on top of all of that. So it's important to make this ponderation. For example, other countries from Latin America, Mexico, Bolivia, Colombia, they don't have a system like the SUS either. We saw what happened in Nicaragua, Ecuador, very dramatic situations. And here it's true that the SUS is fragile. I agree with Gilson. The SUS now is very fragile. Throughout these 32 years, it has not reached the sweet spot. It has not achieved excellence yet. But what happens is that we have not been able to protect the little development that we achieved. So it is fragile. It has to be much more comprehensive and much more production. And nevertheless, it's something that is an achievement. So, Gilson, I would like to ask you, the community initiative is very welcomed at the SUS. The SUS predicts, anticipates participation of this community. There is no SUS without intense social participation. So any initiative from the community is very welcome. Of course, unfortunately, they're happening without the SUS from participating in these initiatives. But I would like to ask you, Gilson, regardless, even if the community is taking care of itself by its own, the SUS is a system that, for example, transplants organs, offers medication that is expensive, that otherwise these people would not be available. So even if these community initiatives are very powerful, like the Paraisópolis case, we have talked about Paraisópolis in Rio, they would not be able to provide and supply this body of actions, activities, and procedures that the SUS has. So it's important that we point out the flaws, the fragilities, the gaps, but we have to recognize the good parts. For example, we have, by having a Brazilian health system, we can, for example, have a queue of transplants applications requests. This puts us in a frontier of research, discoveries that are important for us, that we can even, for us to even modernize our entire capacity of protecting the population, for example. Professor, I think that the SUS is a powerful force. It's at a very fragile moment because of its management. The society has tried to strengthen the SUS. We have been following users in the SUS and the recommendations, the guidance they have already tried to provide the SUS also. But it still lacks funds, technical resources. What we lack the most, nevertheless, is management. I think that Brazil is not a poor country. It's a rich country, in my opinion, in petrol, in water, in or we can get all these resources and invest it in health, for example. So we have to now think of management. We need competent professionals, professionals that are thinking of the next election, but they are thinking of the population themselves. And I think that we cannot have a SUS that is smaller than it's now. It has to triple its size. Otherwise, we'll have risks of new situations like this one, and we will depend on politicians. Many of them are corrupt and that have robbed from this system and caused indirectly many more deaths. I'd like to seize this opportunity, Gilson, what you just said. And thank you also that Dráuzio is here with us again. And Mr. Dráuzio, we're talking about the SUS, the possibilities, the flaws, the strengths of the SUS as a civilization mark also. Before we enter the community activities themselves, we have been very crucial to fight this pandemic. I would like to highlight a sentence you said, Gilson, which is the lack of leadership we have seen in this case. So, Dráuzio, I want to ask you now, why is this virus so dangerous in Brazil? And why are there so many people, including the government, that doubt the danger of this virus? Thank you all. I'm sorry I had to leave, but my connection dropped. Well, your question is difficult to answer because, in fact, we are facing a pandemic. All the countries are facing a pandemic. They are all trying to fight against it the best way they can. But you have to create a national effort with a centralized organization based on which the strategy of fighting the virus will happen. It's very complex. It involves prevention, and up to now, the only weapon we have had to reduce the number of infections is social distancing. There's no other weapon. So we need more guidance. It involves the organization of the national health system, and this organization where the virus is directing itself and understands, and so that we can anticipate the demand for hospital beds. Unfortunately, here in Brazil, we not only did not have this guidance, this guidance centralized in the Ministry of Health, we also destroyed the Ministry of Health. We stopped it completely. We lost this orchestration, which should be centralized. And because of that, the SUS is suffering the most because of the disgovernment, the misgovernment that the politicians, our governing authorities have done so far. We not so long ago, we built football pitches for the World Cup. And when we criticized this, we criticized it because we said that the money could be invested in the national health system. And we were criticized saying that we didn't want the poor to have fun. But now we're seeing what is the actual consequences of investing in the wrong place. The SUS has been the greatest invention of the Brazilian national medicine. We need to have but we need an even more profound transformation. Before the SUS, people that were former workers, they had the right to use the hospitals that were registered with the INPS, which was the national health system then. But all the other workers, the informal workers, housewives, people that worked at home, they were completely excluded from this system, the INPS, because they were not registered with it. So these people they dependent on the help of others. Then a bunch of lunatics and say, let's create the Brazilian national health system. Everyone will have the right to public health in Brazil. And they managed to do that. And they wrote in the constitution that public health is a right of the citizen. And based on that, we created the largest national health system in the world. Brazilians are completely unaware of this. No country in the world with more than 100 million people have the same type of system. I read on the New York Times that this American citizen, he got the COVID-19 and he was hospitalized, and when he left the hospital, he had to pay a really huge bill for the hospital. But here in Brazil, people go to the hospital, they don't have to pay for it. So we are completely biased against the SUS. I remember of the Olympics in England, they put in the middle of the field, they wrote in the middle of the field NHS, the National Health System, which represents that the British are very proud of the NHS. But here in Brazil, that doesn't happen, unfortunately. Of course, the British, they are a population that is very well educated. And so they are much more, let's say, capable of organizing a system like that. But in Brazil, despite not being well educated, we also created the same health system very similar to that of the British. Of course, I think that the SUS is remarkable also because it was capable of organizing itself very quickly. They just needed a bit more money, a bit more fund. If you just paid attention of how the SUS was able to organize itself in this pandemic with all the equipment it needed, I think it's remarkable. I think we have a lesson. Just to conclude what I'm saying, we should be aware that when really needed, we count with the SUS. You may have a wonderful health plan, but if the hospital is completely overcrowded, you won't be able to use the plan. So we count on the SUS, all Brazilians, and we should be proud of the SUS and defend it, because not only us, but our descendants will probably depend on it. Thank you, Dráuzio. So we're talking here how the SUS is a reference to our population in terms of public health. I think we should advance a bit more. on the topic. I think that in Brazil, we cannot talk about coronavirus without talking about inequality. It's because probably the population who's going to suffer the most with the coronavirus, the poor, the indigenous, the black and dark-skinned population. Gilson, as you said before, Palajobs has more than 100,000 inhabitants. According to the Brazilian Institute of Geography and Statistics, it's equivalent to a medium-sized city. And it was even, Paraisópolis was even in the news, in the front page of a very important international newspaper. So what are the main results that you see of coming from this community action? Well, our main motivation was, in fact, noticing that the situation is very complicated and that at this moment of severe pandemic, the situation would be even worse. The situation that the favela have in Brazil, they are worsened the difficulties regarding basic sanitation, lack of water. This is nothing new to us or exclusive to us. We have been experiencing this since Brazil was discovered, when we had slavery. We had an occurrence of 9 deaths. They were killed, and it was repercuted in the international stage. And also, we really want to avoid other deaths like this. At the first
And
moments,
nothing happened. But the great infrastructure, constructions, parks, and schools that were to be built did not happen. So, in a situation like that, in which there were deaths, and then later there was a request to archive the full defense, we thought in a situation like that, nothing was done, let alone in a situation which is general in Brazil, how these favelas will suffer. So we decided, in a lack of a public policy, to create our own public policy using our experience in our mobilization process, where we tried to identify what were the problems, and wherever there were the problems, try and find a solution. The best way to do that, we realized, was to be organized. So we decided to map the whole community, and we were at that moment considering we had 21 homicides, but we have identified to have much more. And we convened the inhabitants that for each 50 houses. So at every 50 houses, we decided to have one voluntary inhabitant so we could take care of each other. And then he has three responsibilities. The first one is to help the people be at home, raise awareness, and then give them the donation when they come. And the third most important one is to call the ambulance service in a situation of help. Then we face this first problem. The service of the ambulances of Samud will not go to the favelas of Brazil. So it is very difficult to have access to the ambulance service. So as of that, we mobilized a campaign of collective finances so we could have 3 ambulances available for the population together with a medical team. And then we decided to create 3 pillars in which we could face issues such as healthcare, social issue, and economic issues. So for healthcare, we decided to hire ambulances, gather inhabitants to be brigadiers, and then we set up 60 emergency bases for those PPE equipment so the population could use that for eventual situations of assistance. We realized the masks is the best way for prevention at this moment. Then we took a group of consulars of Brazil and then we created a program called Home Office with the seamstresses of the slums of Brazil manufacture over 1 million masks for the community, and they also created a voluntary program for telemedicine with Dr. Connecta. So the population which was aware of going to the hospitals could have access from home. And then we created those initiatives and decided to create one more, which was to guarantee the population could be isolated. Because if people live, concentrated 100,000 people in small houses, how can they isolate? That's impossible. So initially we thought of renting mansions and setting up homes, and then decided to occupy two schools in Paraisópolis, state schools, and then we turned those two schools into homes where people who are positive, they may be isolated at places, thus preventing their families and the community. So the first model of home used by society is this model in Paraisópolis, which is being replicated in the whole Brazil. After that, we decided to create a process linked to the distribution of groceries and products. And then we also give them food, over 10,000 different catering. There was a huge line yesterday that there was no more catering available and there were people standing in line. This is a reflect that the economy is very complicated. The process of unemployment is higher. And for some people, starvation has already come. And in the economy, we have tried to make the population continue buying in the local grocery store. The donations may come through local grocery stores. We have other two initiatives. One for the refugees, because go figure, the situation of the refugees in Brazil was complicated. Now it's even more with the community of Haitians, Colombians, Venezuelans, and we are helping a group of Colombians who are camped in the airport of Guarulhos trying to go back home. Last week we sent a group, and today one more group to their country. So we were trying to do that work. And lastly, we created a group of law experts, something like defending the favela, in order to defend the population in situations as it has happened in Brazil, such as the murder of young people and police violence, as you can see, and also situations such as lack of water. We brought a lawsuit against Sabesp to guarantee water may come to our taps because Sabesp is turning off the water supply in Paraisópolis. So everything we started and thought of in those two initiatives, they are now being replicated in over 14 states that are electing their street chairman, street representative, street janitor. Each community has used a different name. But what really matters is that the community, which with a huge network of solidarity, may help each other, and that society may support that. You cannot listen to us, but I guess we could take it. I don't know whether she'll be back. Let's try and talk. She cannot listen to us. So I think we could talk a little more, Gilson, because even this curiosity, in fact, here in Rio, we also have a traditional movement of slums in Rio, as you know, and a huge occupation of churches, etc., very old, and which has been working that way, trying to guarantee the survival of the population and so on. But what I think, and I have been talking to them, I have had this privilege of talking to them, is that we should go further into an agenda that may be more structuring, such as free access to internet. It's not possible that in Brazil we have the most expensive internet. We are at a moment that we have over 60 million people who live in slums, not just in São Paulo, but also in Rio. And those slums, they are increasing in size, they are not decreasing. So I fully agree with you. We must turn them into neighborhoods with rights. An important right is the access to the internet. How can we think that people will stay home if the kids have no access to the internet for some sort of activity? We do not have to be classes or some sort of teaching activity. We have old people. So this is very important. I think it would be very important, Gilson, for us to use the space of the forum here, even to articulate an agenda that may be a more proposing agenda and that may guarantee, that may transform this whole effort. This is, sincerely speaking, it is wonderful. I'd like to congratulate you for that, but it is in an effort of transforming those actions into rights. So this first of the internet, the second one, I think is healthcare. We must talk about that. It's not possible that the community may have to mobilize that way with so much sacrifice in order to obtain the right to an ambulance transportation. So we must, in fact, expand the Brazilian health system, strengthen it. The Brazilian health system cannot be this thing feeble, but good looking, but it cannot be anemic, pale, anyway, that cannot even respond to the everyday problems, let alone a pandemic. So that's what happened. Certainly, the Brazilian health system have been a problem. Lots of people standing in line, difficulties of access, etc. And at this moment, all that exploded. And going back to what I was saying, I guess this is bring magnifying lens in Brazil. The inequalities are so clear, and this is very important. The inequalities have increased. Although we may have democracy, it is important for us to understand that. Although we may have the whole democratic process in Brazil and even a certain increase of income, but the inequality in relation to wealth has increased over this time. Today, we're still being one of the most unequal countries in the world. And this is a problem that we can no longer postpone. So, truly speaking, I guess this set of policies, the health system alone cannot respond for that inequality, but I'm sure it is important for us to understand. And then just I'd like to ask you, because if we have a health system which are privatized, even if they are with the best of the intentions, we end up transforming healthcare not in a right, but into a small possibility. Because the great problem, Gilson, of the health education system is not the investment. It's not, for example, buying an ambulance, but to maintain it. And how can we? That's why it is important for us to, of course, we at this moment we need those initiatives to be emergent, an emergency. There's no doubt about that. But thinking about the future, how can we transform that? How can we, at the same time, have those emergency actions and think about the actions which are structuring? Because we, for example, have this basic care in Brazil. Basic care is very scattered. It has few people working. Those few people, they do not have stability. They have a high turnover. And I'd like to, Gilson, we need to get together. We need to have the health system the size of Brazil and the size of the inequality Brazil has. So I guess we really must refuse to have less than the right to health care. So I guess that's what I wanted to say. What, but for us, it is very important. For us, it is very important, Professor Ligia. And I believe you were trying to find out how can we get together in order to improve. And so this experience we're having, we're going through is such a South away may be as legacy and opportunities of organization. I think we have been able to make a movement, as Dr. Dráuzio said at the beginning, a movement of people with a respirator in the hospital that was a strength, and that strength we didn't know before. Somehow we had this energy that came out, and now we have society looking at healthcare more carefully. And then we have programs which are examples that reach the communities, for example, such as the family healthcare, which is a gigantic work of prevention on healthcare that has to be improved, that has to be expanded, but which is very good. And what else can we do to guarantee basic healthcare may reach people's homes? So the program I consider to be a community program. I don't know whether it is regarded like that in the council, but this is when we have integration of the health service for faraway communities and also community agents who are inhabitants of the place. They know the territory and they know the work is integrated with us. They know where the elderly people are. They know where the chronic sick people are. And with this partnership with the community agents, we're able to quickly know what are the families we should have more careful with. So what's happening in Paraisópolis, we can also do that in Rocinha, because we should establish this bridge process of construction, because we see by political issues, situations of dispute, of smaller issues, and that's not the issue. We have to get together, and I guess all this experience we're going through, it will be a legacy. And even though I do not believe in a process of post-pandemic that is not built now, it's now that we should get together with our governors, congressmen, create laws, programs, a process of mobilization we should continue doing in order to do it now. Because if we do not do it right now, next the situation of the crisis will be worse. And by the crisis, it doesn't justify the lack of investment, the lack of this and that. Everything becomes a crisis. We lived that, and I guess Pirates just live in a situation of a crisis as a response of the government for quite many years. So this crisis is not ours. Brazil is a rich country, but it is a country with inequalities, with income distribution that does not reach those who need it mostly, and that should be changed now. Thank you very much, and especially because you have answered my last question of this block, which are what are the learnings of this pandemic? As you said, it has a longer way to be faced. Today, unfortunately, we have 900,000 people infected and over 45,000 deaths because of coronavirus. And Brazil is an epicenter of this epidemic. We still have a lot to do, but I'd like us to start, as you have already started, thinking about the future. And this is the first thing. What are the lessons learned? You mentioned the bridges to be built between the community and the health system, and Ligia had already mentioned that about how it is impossible for us to go ahead without having the social participation. Health system will exist with social participation. I'd like to give it back to you, Ligia, so we could answer that question. In your opinion, what are the legacies and the lessons learned from this pandemic? I think this pandemic is very traumatic. We feel like crying when we talk about it, because in fact Brazil, the all the infrastructure is not adequate, all the death that could be avoided. The legacy is we can no longer be playing around. We've had enough. We have to take on the leash and decide, because people are deciding it wrongly. People are deciding for us, and they're deciding to kill us, not to kill us all, but kill us inequally. The indigenous people, the quilombola, the people who live in the slums, in the outskirts, the rich, poor, old people, because the rich ones are in their farms. They can be isolated. But who in Brazil can do social isolation? Those who live in a house with 30 square meters, no water supply, no internet. So in fact, I think it is very important for us to stop this situation. I guess there are many social movements that are being introduced, and it is unnecessary. It is we're wasting away lives, talents, and the futures at this moment. So I think the future is there. I agree with Gilson. The future is now. We need at this very moment to demand this reopening may be intermediated by tests. It's not possible that this reopening of activities with no sanitary criteria, with no safety, so many people go back to work and walk around. So Brazil must test that. The government, people must be submitted to some pressure, so they may provide safety conditions, even protect, even PPE for those who work in uh, butcheries, for example, those who deliver food and house workers, they have a risk higher than what is necessary. So we must have measures, I'd say more immediate measures, and we must demand finance for public policy, not just healthcare, but social assistance, housing. This is a joke. Brazil does not have a housing public policy. It's always fragmented, isolated programs. When a government comes, it discontinues what the other government did. So we must get those policies integrated: sanitation, healthcare, education, housing, and social assistance. This is a minimum program of social protection. And we also have to refuse the idea that we'll compete with the policies, will finance healthcare and will not finance education. We'll finance education, but will not finance healthcare. That's what we have been doing over those 32 years after the constitution. That's been happening. We can no longer talk, and we are hostage of the numbers of governments, the number of proposals that are being changed, and we do not have a state policy. We have government policy. So this is a huge problem. I guess we should modernize our institutions. The health system is 32 years, and we must think of institutional reform. What you so called management problem is a little further. I guess we have an institutional weakness. We have people who leave private sector and go to public sector as if nothing had happened, as if there was no conflict of interest. I guess we should take care of that. We must disprivatize healthcare in Brazil. We can no longer admit that public funds are used to subsidize the private sector. We have this perversion. This is a perversion. We have hospitals for rich people. Which will not admit black people. It's easier for a camel to go through a needle than we to find black people hospitalized in those places. Nevertheless, those hospitals, they have public subsidies. We also have inequalities in healthcare services. This is not to be tolerated, because with that we create a culture of segmentation. It is natural that I am hospitalized at this a certain place, and someone else who works in my building will go to the Brazilian health system. This is not natural. This is not the universal health system. It should be equal for those who are rich, for those who are poor. Our health system cannot be a poor system for poor people. We have to stop that. It's not for poor people. It is a universal health system. I'd just like to give you an example. And in fact, Alicia was hospitalized in a British hospital. He's German. He works in England, and he told me it has nothing to do with what I will tell you now. He was saying how it was difficult to be hospitalized with a severe disease. He had never had a disease before. He was relatively young. He was very tired. He was afraid, and he was afraid of dying all the time. But his statement says, and then I had three companions with me. One was an immigrant who was a housemate. The other one was a black person, a British black guy, and he was talking to me a lot. We exchanged experiences. And the third one was someone who was not from the same social class. How interesting. How a Brazilian researcher will have the same kind of experience, will not have. So you can see a universal system It is a system in which everyone is scared at the same way, at the same place, at the same time. So I guess we should transform it into a universal health system. We must have the solidarity. It's not save yourself. I guess the pandemic has shown that we cannot save ourselves on our own. We can all transmit, we can all have the problem. I guess this awareness of our interrelation on how we're human beings and each life has the same value than the other. My life is not worth more than anyone else's. It is worth as much as anyone's human life in Brazil. I guess this is something that is this awareness has been raised. Thank you, Ligia. Thank you for your statements. I'll take the chance for Drauzio's here. Drauzio, I always place it on you. I will never give you the time to get rest. But we're talking about what are the lessons learned, as we still have a lot for Brazil to stop facing this pandemic, but we have lots of lessons learned. Gilson mentioned the issue of the social relationship, the community, the participation, the social control of the Brazilian health system, and how important it is for us to have a health system that is truly universal and equal, more than anything in Brazil. And I would also like to listen from you for us to finish this block. What are the lessons learned from you in this pandemic? I guess first, mobilization with a menace. When you guide the population, when the technicians try and point out the best way, the population understands. We have decreed the partial of end of isolation in São Paulo because São Paulo is getting to the records of deaths. Political decision, we have to be other 2 or 3 weeks wait for the number of cases to drop. And then the politicians, of course, they have different interests. But I do not see the streets crowded with people. Even though many people, if you see the degree of isolation right now and compare to the one last week, it was a little smaller now. But we have a collective awareness on what are the most proper measures, although we may have this mess we had in the Ministry of Health. So this is the first lesson learned. The second one was more than mention of the health system and this whole movement the health system has done in order to try and face the epidemic. That's what we're doing due to lack of tests we could not anticipate, showing it is a system that has the agility. Over to 20 billion reals was taken off the system. In the last 10 years, 13 Ministry of Health were removed, but 13 ministers in 10 months. Well, 10 months, now it is much less. We had 3 ministers of health. And it's been 1 month, we don't have any. That's right. That's why Brazil does not have a health public policy, because you choose those people with political criteria. And what can you do in 10 months? When you start understanding what the ministry is like, you have to give it to someone else from another political party because the political interests change. And that happens in the federal sphere, in the state sphere, and even in the municipalities. I travel around Brazil, and many people tell me the most poor places in the innermost of Brazil. Here, we have to vote the mayor because otherwise you cannot get an ambulance to go to the closest city. So the health system is used as a political weapon. People who do that, they should be in prison.
We need
We
to
must provide
give the
serious the importance it
SUS.
has.
I think this should begin with the authorities. Population has to help, but those that have the money are the authorities. They are the ones that have to define and listen to the population, have an idea what are the problems they face, and based on that, define the public policies regarding health. What hurts me the most is that when you look at the SUS, its entire profile all those working in the SUS, the entire structure can solve most of the problems. I'm an oncologist. I've always been more than 50 years an oncologist. I'm an average clinician. I'm to be very honest. Once a week, I provide services in detentions. They don't have lab exams, they don't have blood tests, and you don't have much time to provide the services to the prisoners. 90% of the cases are solved there on site. If we had the appropriate teams, well organized, trained, funded, we will solve the vast majority of the health problems. The emergency rooms, you know, those scenes that are very dramatic, people on the hall sitting down, all the emergencies room would be completely in line, in order, without any type of overcrowding. If you, because if you don't have the proper management, the proper system, then of course everything is going to be overcrowded. Of course the emergency room is going to be overcrowded because the clinics don't have the proper equipment. And sometimes it's a very simple problem that you don't need to go to an emergency room, but they have to because the clinic wasn't able to provide for them. So we have the family health strategic teams. We have small hospitals in the interior of Brazil. About 60, 70% of the hospitals in Brazil have less than 50 hospital beds. These small hospitals in little towns, they can be transformed into another system, for example, a basic service, and when they can't, they go to regional hospitals. We have regional hospitals spread across the country. Any more complex cases, they go to the large hospitals. We do have the structure. We just have to organize it to make it work and fund it, of course. You cannot provide public, free of charge health to everyone without funding. Thank you, Dráuzio. I think this issue is very important. We have to take it into consideration. I'd just like to add a small thing to what Ligia said. Ligia, the health programs that worked in Brazil that organized for poor people never work. That's a fact. For example, vaccination program, it works wonderfully because it's for all classes, income classes. I take my granddaughter, I take her to the health unit, and no one's going to ask me how much I earn. but you need an organ transplant. You take the guy that lives in a slum that needs a health transplant, an organ transplant, for example. Then he will probably, I think Dráuzio's connection dropped again. Unfortunately, his connection today is not very well, but let's continue. Gilson, I would like to talk a bit more about, we're talking a lot about the structure and need of political support, but there's also the other side to all of this that you talked a lot about, which is the community actuation, how it participates in this development and integration. Both Ligia and Dráuzio, they gave example about the NHS, which is the National Health System in Britain. And it's very impressive that here in England, despite some service problems like any health system, it is a jewel in terms that British are proud of it, and that's not happens in Brazil. A newspaper in Brazil showed that 54% of Brazilians evaluate SUS as bad, and only few evaluated as okay. Jewish, in your opinion, with all the experience they have in these communities, what we have to do to take people to the SUS so that they will value SUS more, in your opinion? I think that it's the integration process. When we're going to do something in Paraisópolis, for example, any type of partnership with a company, I say it doesn't have to come from out of Paraisópolis. It has to be in Paraisópolis. It has to come from this community. Can you listen to me? Yes, yes. So that it's not distant from the population. So it has to come from within the community. Sometimes it's something that comes out from the community, such as health equipment. When we're able to make the population comes closer to the AMAs, to all the health units and departments, and showing that they have to take care of the equipment and how important the equipment is for the community, this advances and makes the community embrace the process. So I believe that when we unite our forces and when we see all the equipment, all the infrastructure, something that is for the community, we'll take care of it, because sometimes population will only mobilize when there's a lack thereof of anything. It's always in extremes that they work, but there's a prevention process that we can work on. If we do that collectively, we are able to bring benefits and prevent problems. As when Dráuzio talked about the family health program, we have here wonderful doctors within this program. Dr. Sidney, for example, he is very well praised in our community, the greatest example of how this physician can lead to results, and there is a prevention process. The family is covered by the program and it's become healthier because of this program. So I believe in this relationship of people understanding that they are united. We have to, I think that everything should be public, in my opinion, because everyone would fight for the same objective. We cannot live in Alphaville, which is a rich income neighborhood, and then Alphavela. We need to understand that everyone has to do their part. That's how it works. That is how it should work. Everyone participating and integrated. Thank you, Gilson. We have a question by our viewers, and it has to do with what you were talking about. We discussed a bit earlier, which is thinking the SUS from now on. Esther Gonzalez asks, what type of SUS Paraisópolis needs? Gilson, I think that's a question that is very relevant for us to continue in our discussion. The SUS we need is a more integrated SUS that has a body of services. So we have some services that work very well here, but others, such as the ambulances, they don't arrive here at the Paraisópolis. So, for example, in a pandemic where you need the ambulance as fast as possible, we cannot let it be like that. We need an ambulance reaching our community. We have been the front page of many papers reporting how much we are suffering in the sense. Sometimes it lacks water. We have situations where we have lacked water because of these crises. So we're still being left aside and being disregarded. This cannot happen anymore. Perfect, Gilson. I'd like to thank this comment. I think that unfortunately, okay, Gilson is back. I was saying that we need a SUS that comes to their community regardless of their income. Okay, unfortunately, I have to tell you all that we are reaching the end of our panel, but I would like to end today's panel asking you about the future of SUS. We talked a lot about the actual challenges, not only because of the pandemics, but all the other challenges that we have faced throughout this 32 years of existence. But now thinking in the following 30 years, what does the SUS need to do to come closer to what it proposes to be, which is a real universal system in fact, and not just in theory? Well, can I start? Okay, well, first we need to do what Gilson was saying. We have a country that is completely individualized. We have this division by social income, by races. We have to face that. We cannot think that the SUS alone will be able to settle all our divisions. With a country that we still have elevators for the maid and elevators for the bosses. So we have to end this. Of course we do. And it's not the SUS that's going to do that. For example, very rich families in Brazil, when they buy an apartment, they still demand that the apartment have a room for their housemaids. The first case of COVID in Brazil was a housemaid that got the disease from her boss. So, Gilson, very small housemaid rooms just to make it registered. It has a window. That's what they think is needed. For example, there's a film in Brazil called Cold Recife. I don't know if you watched it. It talks a lot about, it addresses this issue a lot. So we had this tragedy, the first tragedy in COVID, which happened in Recife, where this housemaid got this virus. And we also had that tragedy in Recife that we saw that touched entire Brazil, with the housemaid's son that got killed because of the disregard of the boss of the housemaid. So rich people in Brazil, they have to change their mindset. We cannot take this anymore. This tragedy we're living now, the 40,000 deaths will reach probably 100,000 deaths. I I think it results in more empathy, more compassion towards the other. Brazil is a very cruel country. This inequality, it's in it encompasses hatred, wrath. I just like to comment that Brazilians, they are not biased against public services because all everyone wants their child to study in federal universities. They study in private high schools, but they want their students to study in federal universities. So of course that Brazilians like public services. For example, the subway, they love the subway, the squares, they are nice, the subways are clean. So we do like, Brazilians do like public service. So if we understand that we can have quality public services, Brazilian will like it and will trust it. But for that, just to conclude, we need to not only invest financially, but we have to also invest emotionally. We have to invest with our affection, and the transformation needs to be real. We are constructing this possibility. Today we have learned to demand more, which is good. Businessmen, they want to create more health care plans, but it's not going to work. It's an agenda that makes no sense anymore. I think that the SUS is coming out from this crisis, will come out from this crisis as as a service that is going to be perceived as necessary, and due to that it will become stronger. So we need to also continue debating, have other panels, right, Lia, so that we can have health. We need healthcare. That's a fact. That would be excellent. I agree with you. Dráuzio, just to conclude, if you could please tell us what we need to do in the following 30 years. Well, the SUS, when we talk about income distribution in Brazil, the largest program of income distribution in Brazil, the Bolsa Família. Bolsa Família is nothing compared to the SUS. The SUS invests 250 million per year. It's the largest program of income distribution in Brazil. You're seeing now at the peak of this tragic pandemic, companies making donations, whether through money, respirators, staples, they donate the way they can. I'm part of a group that administers the application of the allocation of this fund of 1 billion that Itaú Unibanco has distributed to the pandemics.
Explaining and define what that is, when it's worth investing that way. And those are people of the highest level. They are prepared, and we have a deep discussion on the program. That's it. We use the whole structure of the bank later, and then you decide, well, 10 respirators will go to Roraima state. Well, okay, send 10 respirators there because that's it. But then you use the infrastructure of the bank. Why is can't the private sector collaborate that way? Taking it to the health system, it's an expertise our health system does not have. It has for the poverty due to the lack of organization during over these years. Train people in order to work, in order to have a better medicine in the health system, give it the management it has never had. Because management today, in the modern management, it is difficult. It is people who have education, people who are ready, people who go on graduation courses. Those people, most of the time, they are not in the public sector and the private sector. I guess there must be an awareness raised by all of us that living in a country with this inequality is not possible. We struggle a lot. We suffer with the urban violence. We're all locked into our houses. Poor people are locked into their houses. If you go on the outskirts, you will see all the houses, they have cages and the gate is closed. This huge violence. And we're in the hands of human violence. And then we have an epidemic like this. What's the point in having a boat and resources and you're locked at home? While there are infected people will not be free to walk around. I hope this awareness may bring enthusiasm and give some direction to people, the generous people who are rich, who have the conditions, they have companies to think a little about the Brazilian population. What can we do so out of all that there may come a less unequal Brazil? I guess that will help the Brazilian health system and the whole country as a whole. Gilson, please close our debate by telling us what you think our health system should do in the next 30 years to be universal and equal. Thank you. Well, I guess, as I have already said, if in the post-pandemic, we need a future that will initiate now. So I believe within 30 years, we should strive so our health system could be more independent, not dependent on the election, and that it's not a political party instrument to be exchanged for votes. We need it with investment for Brazil, not for the politicians, so they may use it for corruption. I also wish we will not admit over 100,000 people will die and we'll have Brazil unprepared. 45,000 people died today. Up to now. We had little time, but the little time we've had so far for the governments was little used. Here in São Paulo, they said 11,000 people would die. It will be much more. I guess up to yesterday was 10,000, and little was done to prevent so that would happen. So within 30 years, but the little time we've had so far, and then that happened, and that people may be strong, mobilized, and the investment, and that will be tested based on science, what the population needs, and that starts now, not in the future. Thank you, Gilson. I'd like to take the advantage of Gilson talk and invite you who is watching us now, the recognition to the extraordinary times we're living. In closing, each panel Brazil for UK 2020 will present a financing campaign related to the topic we just discussed. We'd like to invite all of you to get to know better each campaign and contribute to the causes. All information will be further detailed in the social media of Brazil Forum UK. Today, I'd like to highlight the GTN coordinated by Gilson is organizing a donation campaign of funds to help fighting the pandemic in Paraisópolis, Islam. All the amount donated will be used for local entrepreneurships, help inhabitants who lost their jobs, allow them buying groceries, hiring transportation, and healthcare professionals. If you'd like to help, just try and find Brazil Forum UK in social media, Facebook, Twitter, Instagram, LinkedIn, in order to know more. If you want to talk a little bit about this campaign, Gilson, please. I'd like to thank you for the opportunity and let you know that even from home, you can help those who need mostly at this moment. We need food. Starvation has got here. People need help, and society has mobilized in order to help, and we're counting on everybody's help. Thank you, Gilson. Unfortunately, at least for me, because I love to be here with you, this is the time for us to say goodbye. I'd like to thank very much each one of you for the conversation and for the contributions. Thank you very much, Ligia. Thank you, Gilson. Thank you, Dráuzio. Thank you very much for having built this dialogue with us, which was so fair and open. I'd also like to thank the team of volunteers in the organizing committee, especially Leonardo Soares, Eduardo Carvalho, Julia Bussado, Carolina Lima, and Marcos Rodrigues, who participated in elaborating this healthcare professional. Studio coordinators for the production, Cross for the interpretation of English live, and more difference everybody can see here with our interpretation in Libras Estadão TV broadcast for the transmission, and you who have been here with us so far. Brazil for UK 2020 will be back next Friday, 19 June, 5 p.m. Brazil, 9 p.m. UK on environmental governance in the Amazon. We will have Carlos Nobre, the representative from Socio-Environmental Institute, Adriana Ramos, the governor of the state of Pará, Hélio de Barbalho, and the coordinator of the articulation of the indigenous people of the state of Amapá and north of Pará state, Simone Caetu. We'll be waiting for you. See you there. Thank you very much. Thank you indeed for being here, sharing with